Ken Landau. Thanks for watching. Let's talk about vitamin C. Vitamin C is a water-soluble vitamin that's not well stored in the body. Actually, about 40% of Americans consume supplements of vitamin C in one form or another. Has several biologically active forms. We call them vitamirs. It's not just one substance that's vitamin C, a variety of substances fall into this vitamir. So we have the ascorbic acid in the reduced state. We have the dihydroascorbic acid in the oxidized state. Vitamin C is on the World Health Organization list of essential medicines. Most animals can synthesize vitamin C. So it's synthesized from glucose in most mammals, synthesized in the liver. In amphibians and in reptiles, it's synthesized in the kidney. It's synthesized by plants from fructose, not synthesized in the human body because we lack a certain enzyme. We lack something known as galonolactone oxidase. And without that, you can't synthesize the vitamin C. Same thing in birds and guinea pigs and certain insects and certain fish. Where do you get the vitamin C? Get it from fruit and vegetables for the most part. Best source, bell peppers. Then there's plentiful amount in oranges and kiwi and lemon and grapefruit, in strawberries and in tomatoes. And you get it in broccoli and Brussels sprouts and cabbage and cauliflower, but you don't get it from animal sources. And if there were any, it would be destroyed in the heating process. It's not in eggs. It's present in breast milk in varying quantities, more so in human breast milk than in the milk from cows. Interesting, we don't see scurvy in neonates. It seems that among all of the different vegetables, broccoli maintains the vitamin C the most when you cook it. But unfortunately, with most of the vegetables, about 60% is going to be lost in the cooking water, 60% of the vitamin C. The amount that's present in the vegetable has a lot to do with how long it's been sitting on the grocer's shelf and the climate, the soil conditions, the variety of plant, the transport, all of that's very important. Highest concentration, of course, is in vegetables and fruit that is picked at the peak of its ripeness, and if you eat them raw, well, it's destroyed with too much light. So if you let it sit out on the counter exposed to the sun, it's going to lose some of the vitamin C. The best thing is to quickly heat the product, use a little bit of water when you're cooking it, or consider just stir frying. If we look at how you get your vitamin C, well, it's about 40% coming from the vegetables, about 20% is going to come from fruit, and about 30% going to come from fruit and vegetable juices. So if you take in some vitamin C, it doesn't matter how you take it, whether it's from food or whether you take it from a supplement, if you consume less than 100 milligrams at a time, you're probably going to absorb most of it, 70 to 90%. But if you take high doses, like if you take more than 1,000 milligrams, well, the absorption rate is going to go down to way under 50% because the intestines where it's absorbed have certain mechanisms that you can saturate. And once the intestine is doing its maximum, can't do any more. So, for instance, if you wanted to take a lot of vitamin C, taking 250 milligrams 4 times a day would be better than taking 1,000 milligrams once a day. Because remember, once you saturate those intestinal transporter proteins, not much more is going in, and it's going to be metabolized by the bacteria in your intestine, and it's going out. And any excess that you do consume that does get into the body is going out in your urine. So the way that the vitamin C is absorbed in the intestine has 2 different mechanisms. One is glucose insensitive, that's the minor route, that's simple diffusion. But the active route, where you get most of the vitamin C absorbed, is what we call a glucose-sensitive pathway. And we have active chemicals that take the vitamin C from the intestine, bring it to the inside. GLUT1 and 3, they only do the dehydroascorbate. Then we have the SVCT, that stands for the sodium-dependent vitamin C transporter. That only takes care of the ascorbic acid. Well, deficiencies are rare in developed countries, but certain people push the limit. So if you follow some kind of a crazy diet, if you have a macrobiotic diet, if you're poor or elderly and can't afford fruit and vegetables, or if you happen to abuse drugs or abuse alcohol, then chances are your diet's going to be deficient. Same thing basically with cigarette smokers. Cigarette smokers metabolize vitamin C much more aggressively than non-smokers. It seems that in the course of any given day, you're going to lose about 3% of your body stores of vitamin C. That means you lose about 40 to 50 milligrams of vitamin C every day. Vitamin C was discovered, the concept, the chemical, was discovered in 1912, isolated in 1928. Actually, Dr. Albert St. Georgi got the Nobel Prize for describing the vitamin C from paprika, of all things. 1932. 1933, it was the first vitamin to be produced chemically in bulk. And then 1934, Hoffman LaRoche trademarked it and started marketing it as a supplement. Well, we've known that a lack of vitamin C causes disease. We've known that for a long time. But it sort of began to crystallize during the era of the expeditions, on the explorers, on the boats, on the travel from the old world to the new world. Well, as long ago as 1497, the realization occurred to individuals that, hey, you know, we're losing an awful lot of sailors from some disease. We don't know what the disease is. Turned out it was from scurvy. And about half of all of the sailors, or more, could be up to 70 or even 80%, on the journeys, that percentage of the sailors actually died from scurvy. Well, they got the idea that there was some sort of benefit from fruit and vegetables. So some of those early explorers actually would take along some oranges or some lemons, and then they would plant trees in some of the areas where they passed, realizing that on the journey home they would pick up some of the fruit and vegetables. But it all came to a head in 1747 when James Lind, who was a Royal Naval surgeon in the British Navy, he did the first controlled experiment ever. What he did is he gave everyone the 2 oranges and a lime, and he gave that to the study group. He gave the standard rations to the control group. And by 1753, they knew that scurvy, all of the problems that they were having, seemed to be able to be rid by simply eating fruit. So between the years 1500 and 1800, somewhere in order of about 2 million sailors died simply because of a lack of fruit and vegetables. Well, unfortunately, they got the idea that you didn't really have to carry the fruit. You could take the fruit juice. So they boiled it, stored it in copper pots, but it really destroyed the vitamin C. So the problem recurred. Then the sailors were issued lemons starting in about 1800 and 1860, changed to limes and lime juice. That's where the British Navy got the term limey. Well, what is the scurvy? What's that all about? Well, scurvy is an interesting condition that's associated with low levels of vitamin C. And because of the low levels of vitamin C, you get malaise and lethargy and fatigue. You lose your taste. You lose your hair. You get short of breath. You have pain in the joints and in the bones. You can't form new connective tissue. If you get a wound, you can't heal it. You're practically immobilized from the pain because of the joint disease that's associated with it. You bleed into the joints. You bleed into the abdominal cavity. You bleed into the pericardial cavity. You can bleed into your gums. You lose your teeth. Children have impaired growth because they're not making bone. Actually, pseudoparalysis develops in children who are very deficient. Can't absorb iron because vitamin C is required to absorb the kind of iron that you get from plants and leafy greens, not the kind that we call heme iron that you get from meat. People, because they're iron deficient and anemic, they look pale, they feel depressed. Early on, all of that's reversible by just taking a little bit of vitamin C. The question is, how much vitamin C? Well, they did some experiments in prisoners, and what they did was they deprived them of any vitamin C. And they found that the symptoms of scurvy started after about 4 weeks. Now, they had previously done studies over in Britain, and it took them 6 to 8 months to develop scurvy. But what they had done is they preloaded the people with vitamin C. So if you don't preload, it takes about a month. How can you relieve all of the symptoms? Just 10 milligrams a day seems to be sufficient. So what's the RDA for vitamin C? Well, for men here in the United States, it's about 90 milligrams a day. Women, 75 milligrams a day. If pregnancy occurs, then it's about 85 milligrams. For breastfeeding women, it's about 120 milligrams a day. And interestingly, if we look specifically at cigarette smokers, they're told to take an extra 35 milligrams a day. It's not a formal recommendation, but it's the suggestion because they seem to have increased turnover and they have a poor diet. Well, they have, when you look at the side panel of your food, they have what's known as the percent daily value. And up until recently, the percent daily value was listed as 60 milligrams here in the United States, but in May of 2016, they changed it to 90 milligrams. But the original deadline that was going to be in July of 2018, well, when it got to 2017, they extended it. So big companies have to have the percent daily value at 90 milligrams as of January 2020. Large companies, small producers, January of 2021. What's the RDA in other countries? It varies significantly from 100 milligrams in Japan. Canada has basically the same as we do. In Germany and Austria, it's 110 milligrams. But the World Health Organization and the authorities in India say 40 milligrams is quite sufficient. The requirements for vitamin C are increased during pregnancy and lactation in cigarette smokers, people on hemodialysis, and people who have significant stress due to either infection or trauma. Now, actually in Canada, they require supplements of vitamin C in certain kinds of foods, and meal replacement products, evaporated milk and flavored drinks and mixes and different concentrates. The normal level that you should have in your bloodstream is about 70 micromoles per liter. You're marginally deficient when it gets way down to somewhere between 11 and 28 or 30 micromoles, and you have a severe deficiency when you're less than 10 micromoles. Now, we find different areas of the body tend to concentrate the vitamin C. So certain areas seem to require more than others. The upper level of intake, well, if you take more than 2,000 milligrams, you may well find you're doing yourself some harm. At least that's what the Institute of Medicine says here in the United States. On the other hand, the authorities in Japan and Europe say, it doesn't make any difference. There's no established upper limit. But if you do take more than 2 grams a day, that's 2,000 milligrams, you may develop some abdominal pain and some diarrhea and nausea because the vitamin C acts like an osmotic laxative when it gets into your intestine, and the bacteria start to digest it. And interestingly, it seems that especially in those people who've had kidney stones, especially men, that if you take a lot of vitamin C, more than that 2,000 milligram limit, that you put yourself at risk for developing extra kidney stones. And then there's a question about iron. Now, although we think that most people have a lack of iron, actually there are more people who have too much iron in the body than too little iron in the body. And as a result, since the vitamin C is important in iron absorption, you might get too much iron. That's a thought anyway. And then there's the right amount. You have to balance the amount of antioxidant with the amount of pro-oxidant. And as you take more and more of the vitamin C that you think is an antioxidant, well, in the body it acts as a pro-oxidant. And as a result, it can cause some problems and even potentially lead to disease. Other problems associated with too much vitamin C would be headache or trouble sleeping or flushed skin in some individuals. Now, if you do get too much vitamin C and it gets into the system, well, it's going out in your urine. If you don't have enough, the kidney is going to conserve it. So it's going to hopefully hopefully keep you relatively in balance. How much vitamin C is in your body at any given time? Well, the average individual, about 1,500 milligrams to 2,000 milligrams. The level at scurvy is way down when you get to less than about 300 milligrams. Find that you're saturated. Once you get more than 1,500 milligrams, 2,000 milligrams, taking more isn't going to do you any good. The biologic half-life of vitamin C is somewhere between 8 and 40 days. You break down, as I mentioned, about 3% of the vitamin C every single day. Find the most amount in your pituitary gland and your adrenal gland. You find a significant amount in the lens of your eye and in your brain, less so in your kidney. Fair amount in your bloodstream, in the white blood cells. Seems that vitamin C has a variety of important functions. So it helps with the absorption of iron and copper. It maintains the glutathione in the reduced state. It helps with the regeneration of vitamin E. It stabilizes folic acid. It's an antioxidant. It's a reducing agent. It's anti-inflammatory. It protects the microcirculation. Promotes the absorption of non-heme iron, not heme iron. It's important in the carnitine biosynthesis. It converts dopamine to norepinephrine, so that's a neurotransmitter in the brain. Seems to be essential for wound healing and for the growth of the connective tissue. It's antithrombotic, prevents excessive coagulation. It has a role in vascular function with nitric oxide. Donates electron to a variety of different enzymatic and non-enzymatic reactions. Well, it's also something that protects the lipids, the LDL, that bad cholesterol, from being oxidized in the system. Well, when it's oxidized, you get the oxidized LDL, that seems to promote atherosclerosis. And it also is in a high enough concentration in the gastric juice so that it prevents some of the potential cancer-causing nitrosamines from being formed. Additionally, it seems to help in the transport of fatty acids into the mitochondria so that they can make energy. And then, of course, we know about the role in the collagen formation and the blood vessel formation, the cartilage formation. Well, the whole concept of how vitamin C works changed in the 1980s. Up until then, it was thought to be the oxidant, antioxidant, but then it was thought, no, it probably works more with the immune function and the enzymes and the non-enzymatic reactions and the metabolism. It was synthesized in China, actually. And as of 2017, 2018, China is still producing about 95% of the world's support, or world's quantity, of ascorbic acid. That's a major export. They export almost $1 billion every year of vitamin C. Now, the natural form of vitamin C and the synthetic form of vitamin C metabolized exactly the same way. It doesn't seem to make any difference. If you take too much vitamin C, it might interact with the old-fashioned guaiac stool blood tests, could interfere with the urinary glucose measures. And sometimes, if you get too much of the vitamin C and you're unfortunate enough to have a tumor called multiple myeloma, it might interfere with some of the drugs that are used to treat that. Now, the Institute of Medicine says, hey, don't take too much of this stuff. It really isn't doing you any good. And all this idea about it being preventive for cancer or coronary vascular disease doesn't seem to work. Actually, studies have been done time and time again. The idea is that, well, if you're stressed, if you're really sick, you need extra vitamin C. So they studied it. They studied it in people who had sepsis. They did over 100 papers looking for some sort of improvement with added vitamin C, and they found that it didn't make any difference. Actually, the outcome in people with sepsis and the outcome in people with sepsis who were given the vitamin C and not given the vitamin C was exactly the same. The last paper on the subject was in January of 2020, looking at vitamin C in people with sepsis and shock. Looked at 28-day mortality, people given the supplement, people not given the supplement, didn't make any difference. Cardiovascular disease, no, it's not going to decrease the likelihood of a heart attack or a stroke or cardiovascular-related death or even all-cause mortality. Actually, a severe deficiency in vitamin C, like into the scurvy family, that might be associated with increased incidence of heart attacks, But that's only in severe deficiency. How about Parkinson's disease or Alzheimer's disease, diabetes? No. Preterm delivery, breathing difficulties, eczema or hearing loss. Does it help prevent gum problems, periodontal loss, multiple sclerosis? No to all of those. Does it help with endurance training? Does it help with muscle strength? Does it help with your ability to exercise more? The answer again is no. Does it help prevent cataracts? Because we know that the lens has an awful lot of vitamin C. No, it really doesn't prevent cataracts. Now, if you happen to consume the vitamin C with fruit and vegetables in that form, yes, it does. Supplements, no. Doesn't help with rheumatoid arthritis. Linus Pauling, who was a very intelligent man, who won several Nobel Prizes, he said that you should take massive quantities of vitamin C, and he believed that it could cure the common cold, prevent the common cold, and then later on in his life he thought it could prevent cancer. Well, they did studies on all of that and found that no, it didn't do anything. They actually have more than 23 different community studies looking at prophylactic vitamin C, doses as high as 2 grams a day, 2,000 milligrams. No, doesn't prevent the common cold. There's some minimal evidence it might shorten the incidence of the common cold if you happen to be a skier on the South Pole or the North Pole. But for other individuals, no, it doesn't seem to make any difference. And cancer prevention? Studies have been done time and time again, and they just can't find any significant reduction of lung cancer or kidney cancer or breast cancer or prostate cancer. And actually, the granddaddy of all the studies came from the Mayo Clinic. Nope, not effective. So there are some people who have the concept in orthomolecular medicine, whatever the heck that is, that you need to take high doses and you need to get it intravenously. No, remember, the body knows what to do with the vitamin C. And if you get too much in, it goes right on out. So the granddaddy of all look-sees was the Cochrane study. And they found that it doesn't have any effect on the overall mortality. So that's the story of vitamin C. You must consume enough of it. It's a very important vitamin, of course. But do you need a supplement of vitamin C? Is it going to help you in any way? Overwhelmingly, the answer is no. If you want to get enough vitamin C, go have some broccoli or a Brussels sprout or an orange. Your body's going to appreciate it, and the extra fiber is going to do you extra good. So anyway, thanks for watching. If you enjoyed the show, please tell a friend, consider subscribing so you'll be notified when we post new videos. I appreciate your interest. I'm Dr. Ken Landau.